Awesome. Getting a good group. We'll start in just a minute. Fantastic. Okay, well, welcome everyone to our webinar on introducing the diamond with Dr. Douglas Petersen. This has been a long time coming, so thank you for being here live. My name is Christy Jones. I will help facilitate any questions that are coming through in the chat. But you are really here to hear from the wonderful Dr. Douglas Petersen, the brilliant mind behind this assessment. This will be a real treat for you. So good job making it here live. This will be awesome. If you have any questions at all, there is a Q&A feature within this webinar. So feel free to enter your questions there. We'll be keeping an eye on that, or you can throw anything in the chat. Take it away, Dr. Petersen.
Okay, thank you. I don't know if that was just my problem or what, but you froze there for a little while. So, but thank you,
Sorry.
Christy.
Yeah.
Oh, it's okay. That's all right. Welcome, everyone. I'm excited to talk with all of you about the diamond today, just for a little bit. I'm going to give you just a brief overview of what this assessment is, what its purpose is. I'll talk a little bit about how it's administered, but not a lot of that. Talk about the evidence of validity, the estimates of reliability, some very important things about that to talk about, the normative sample. And then also I'm happy to field some questions, which we'll do at the end here. So I have just the test itself really that I'm going to share with all of you. I'm going to toggle through the examiner's manual and then also the protocol form and the stimulus book. But I want to, of course, acknowledge my co-authors, Trina Spencer, who has been with me on this journey from the beginning. And Trina and I have been working on this assessment for over 10 years, far more than 10 years. And then also want to acknowledge Elisa Konishi Turkelson, who's I don't know if she's watching us up in Alaska, but Elisa had a huge role to play in the development of this test. And then, of course, I have to acknowledge Olivia Petersen, who has done all of the design work and made all of this research something that people can access, and Cameron Lettich, who has managed all of the data collection from across the country and the world. So I just want to throw a shout out to them. And there are many, many hundreds and hundreds of people who had a role to play in this assessment. So this is the DYMOND. It's a norm-referenced dynamic assessment of language and decoding. Those are very unique words to put together. This is the first of its kind. So one of the things that I want to do, I'll get past the table of contents, and I just want to talk about the uses, the interpretation, and the intended consequences of this assessment. So assessment should really clearly tell you what their purpose is, why they were created, and the way that you determine whether a test is quote unquote valid, which is not really the right way to talk about a test, but the way to talk about this validity idea is whether it meets the expectations or the purposes for which it was designed. So 3 purposes. The first, it is to help examiners make decisions about whether a child has a language learning disorder. Second, to help examiners make a decision about whether a child has a decoding learning disorder. And then third, to help identify strengths and weaknesses and to also identify instructional targets. Those are the 3 major purposes of this assessment. Now, this test is designed for children who are 5 years old through 14 and a half years old. And it takes about 15 minutes or so to administer. It depends on the subtests that you choose to administer. And it, of course, also depends on the child. This is a dynamic assessment. It is standardized, but at the same time, there is some fluctuation in the time that it takes to administer based on the student's responses. So the Diamond has three major sections to it, three major sections, I should say, well, actually four. So it has the dynamic assessment of narrative discourse. And this, I'm just going to shift over here to the protocol for just a brief moment. The dynamic assessment of narrative discourse is a task where you have a child listen to a story, and while you're telling the story to the child, what you do is you put these pictures and these icons in front of them, and you have them first listen to you tell it, and you identify the different story grammar parts of the story. And then the student retells the story. And the process here is that as the student is retelling, you are recording what they can do independently. And then also, so this gives you static information, what a child can do. And you're keeping track of the story grammar first. That's the primary focus here. And then anytime they leave anything out or if it's unclear, then you are prompting them and you're teaching them. And there's some procedures that we follow to do that. So this is a process where it's very interactive and you are teaching the student or the child how to tell this story and to include not only all of the story grammar, but also tier 2 vocabulary. And you're also having the student retell or repeat sentences that have fairly complex language in them. So that gives you a lot of information about a student's language just in this particular task. And then what you do is you get information on what they can do independently just with that very first dose of instruction, and then what they can do once you take the pictures away and you only have the icons, which is this next step here. You have them retell the passage again, and you score it exactly the same way. You have them tell the story independently as best they can, and then you jump in and help them as you need to, and you get a score. Now that's very informative, actually. The scores that these students get with the pictures and the icons, and the score they get with just the icons is highly predictive and helps identify language disorder. And then there's a responsiveness scale. So we attend to how the student responded during the intervention, during the teaching phase. It's across multiple features or aspects of behavior here. And I won't go into all of the details. I don't want to get into the weeds too much, but the big idea is that you get a sense of how difficult it is or how easy it is for a child to learn language. And the hallmark characteristic, I guess you could say, or one of the core characteristics of language disorder, including developmental language disorder, is difficulty learning language. And this test taps right into that construct. So one of the reasons why this assessment, and I'll get into the psychometrics a little bit later, but one of the reasons why this assessment works across a very, very diverse group of children is because it's not about exclusively what they can currently do. It is also about their learning potential. And we'll get into that a little bit later, the psychometrics. The other part of the test, the second part is a dynamic assessment of inferential word learning. So you get information on their narrative discourse, sentence complexity, vocab complexity. This gives you information on their inferential reasoning, their ability to infer the meaning of more complex, or in this particular case, very unknown nonsense words from context. This particular subtest is used really for informing instruction and identifying strengths and weaknesses. The third piece of this assessment is the dynamic assessment of decoding, and this helps you identify children who have dyslexia or decoding learning difficulty. And there's a couple of different subtests in this. One is for kindergarten and first grade, which is simplified with these simple CVC or closed syllables. And then with older students, there's a task where you obtain an inventory of their ability to read these nonsense words. And then there is a teaching phase involved where anywhere along the continuum here, wherever they struggle the most, you teach these particular words and you teach them how to recode these words. And again, it gives you information on their learning potential, not Do you know how to decode? Do you know how to recode these nonsense words? Yes, that's interesting and very informative, but it also tells you how well can you learn? How well can you learn to decode? The last task is a rapid automatized naming task, which is a pretty quick task where students are supposed to name the color and the animal as fast as they can in 30 seconds. So that's a very, very brief, ugly overview of this assessment, just so you can see like what the big picture is of this test. Um, and the assessment has, as I mentioned, the intended population is 5 years old to 14 and a half. The examiner qualifications are individuals who have specialized training in assessment, evaluation, diagnosis of language and or reading disorders, and about 15 minutes, which can vary. Not all the subtests need to be administered, and I want to skip around just a little bit. I'm going to go to the protocol here. I want to highlight a couple of things about this protocol. So the very first page of the protocol, what you have are a language learning index and a decoding learning index. Now you have decoding learning index for kindergarten age children, and then a decoding learning index for students who are in 1st through 8th grade. Those are the two big indexes that you get, and it gives you information on how well students can learn language and likely the probability that they have a language disorder or a decoding disorder. So this is unique though, because on this front page, the only thing that you use to actually calculate these indexes are these particular subtests. And the other subtests that we have in the DYMOND are set aside for something different, for a different purpose. And I'll show you that page in a moment. But it's pretty traditional here, right? Where you put in the raw score, and then we have tables where you'll calculate the scaled score, percentile rank, and the confidence interval, and you'll provide, and you will report, or I shouldn't mandate that, but I do hope that you will report the confidence interval and the range of the standard score and the percentile rank according to either 90% or 95% confidence interval. It's a traditional approach in this particular case where you transfer these scores over, these scaled scores over, and you get the sum of scaled scores. And the sum of scaled scores will give you the information that you need to then convert that to standard scores and percentile ranks for the indexes. Here in these little boxes, you can see we have little flow charts. This is the language learning, decoding learning for kindergarten, and decoding learning for 1st grade. You will put in here the sum of scaled scores. And we have cut scores here. This is a generic cut score. We have more specific ones, though, if you want to get very precise. And based on this cut score, you make the determination of the probability of someone having a language learning disorder or decoding learning disorder. And here for these particular cut scores that we have the sensitivity and specificity reported down below, but this is not the optimized sensitivity and specificity per age band, which I'll show you in a moment. But if you want to just use this generic cut, you can. So that's essentially this part that you use for identifying the first purpose, right? For first two purposes: identifying language learning disorder, or identifying decoding learning disorder. The second purpose is to identify strengths, weaknesses, and instructional targets. And here is where you will put in some of the subtests from above, but also additional subtest information and scores. And what this does is this provides you a lot of information on relative strengths and weaknesses that the student has. And we have just very, very brief instructional targets, like ideas for what it is that this particular subtest does to tell you about the strengths and weaknesses and instructional targets that you might focus on. And you can plot the pattern here. So in this particular case, what you'll do is you'll draw a line at the scaled score. Let's say they have a scaled score of 7 on step 1 at the teaching phase. You draw a line here, a little horizontal line, and then a vertical line going up to the midline here, to the mean, which is a scaled score of 10. So it gives you this picture of who is in what areas they're performing below, within, and above the normal range. Okay, so that's kind of this overview of the protocol form that you can see. And okay, now what I want to do is I want to skip to a few things. I'm going to get past this whole administration piece. Now we have step-by-step guides in here for you on how to administer and score this test. And also on the protocol, we provide a lot of information on how to administer and score the test as well. So you don't need to flip back and forth from the manual to the protocol for the administration. Um, I'm not saying don't read through the manual, please do. It will help you considerably. But once you're aware of the general process, there are um, lots of key information on the protocol. Okay, so all right. Oh, I just wanted to show you this little picture right here real quick. Sorry if this is making you all really dizzy. Um, this is an example of that profile analysis here for strengths and weaknesses for an example student. Okay, now I want to talk about the development for a moment. I'm not going to get super deep into it, but we used um, Bachman and Palmer's AUA model to guide the development of this test and the validation of the test as well. And that's very much based on Kane's work and also on Messick's work. But you'll find these little guideposts along the way in the technical section of the manual. And you'll notice that we start with, in the development of the test, we start with intended consequences. And that's really important to establish what it is that we want to have happen based on someone administering this test and interpreting the results of the test. And so in this technical manual, you will see in this technical section, you'll see that we talk about the intended consequences and the intended decisions that we're expecting people to make in the interpretations of what we expect them to make from the scores and how the student performs. So I just wanted to give you a little overview of that so you can see how it's designed. It's designed differently. A lot of assessments have this information on, quote unquote, content validity or construct validity or face validity. And that's really not in alignment with where we're at currently with our understanding of validity, which there's not like different sections of validity, really. These are just evidences of validity. And so this whole manual is designed in that way. And we walk you through how we designed this test, what the intended decision was based on the performance of the student and their scores and so forth. So hopefully it's informative and helpful for you to understand what's in the test and why it's in there. Gives you information on the content, right? Okay, so I'm going to just scroll all past this, which I don't know, took years to do, and sadly, I'm just going to scroll right by it. Please don't do that yourself, though. Please take the time. I'm just going to get us right down here to the normative sample. So in this particular test, we administered the DYMOND to 1,454 children across 80 sites across 36 states. I wish I could zoom in. I have a little beautiful, I hope everybody can see the little font right there. And if you can't, I know you can't, and that's probably a good thing. But a shout out to my home state of Alaska, by the way, which has wonderful representation in this test. So 1,454 children tested, and there's a couple of really key things to understand about the normative sample. So here's the state representation, and a couple of things just to highlight. Students who, I'm just going to scroll into this right here, the normative sample provides data on children who have typical language learning ability and typical decoding learning ability and typical cognitive linguistic development, okay? So we have a whole other sample of children with language learning, decoding learning difficulty that I'll show you in a moment, but this particular normative sample has children with just typical language and decoding learning skills. You can see the breakdown here. You have pretty even representation here between male and female. And then we have race and ethnicity here. We represent multiple races and ethnicities were represented in the test, including 359 multilingual children, whereas most assessments The vast majority of norm reference assessments do not include multilingual children with significantly limited English language, but that is not the case in this particular test. So the normative sample is far more reflective of the diverse diversity of the United States. We have the age breakdown and socioeconomic status, as well as including grade breakdown. So a couple of important things, of course, to recognize about the normative sample. Typical children in that normative sample and children who are multilingual are also included in that sample. And we found that essentially children who could just understand very simple English language instructions, including children who had a score of 1 on the WIDA assessment, an MLU of about 2.0 or so, those children could still successfully participate in this assessment, and we could get valid information about them. And so there are very few children that we could not test. And in fact, we took this test to Japan and administered this test to multilingual children in Japan, and were able to administer this test to the vast majority of those children over there as well. The reference standard, if you're not asking this question, I want you to. And this is all about, how did we know who had a language disorder? How did we actually know who had dyslexia? Those are really important things to ask. And we essentially used the information from the school system, whether a child had an IEP, and specifically for what services they were being provided, for what reason they were being provided services in what area. And then we also did additional examinations to confirm the reference standard. So we took language samples from the vast majority of the children, or no, that's not true. We took a subset of children and did a language sample analysis with those children. And there were significant differences between the children with typical language and those with disorder. And we also administered a non-word repetition test to almost all of the children, and also found significant differences in the groups of children with and without language and decoding disorder. And then for confirming decoding learning disability, we also did a sub-analysis to further confirm that. So just not just relying on an IEP, but trying to also confirm that these children really do have a language or decoding disorder, which is crucial to the sensitivity and specificity analyses that we did later. So the children with language disorder and decoding disorder, we had 295 children with language disorder and 162 children with dyslexia or decoding learning disorder in the sample. And you can see the breakdown here of those children and how they're represented. So pretty large sample of children with language disorder as well, and decoding disorder. Okay, so that's the normative sample, and I hope that's interesting to you. It was very interesting to us to do that. It was very exciting to us, actually, to be able to essentially include all children that we wanted to, that we had tested across the country. And in some cases, we administered the DYMOND to entire schools, to all children in the entire school, almost like a universal screener. So we have quite the representation of children. Okay, so now I want to just get down to validity. I'm going to skip our theoretical foundation, which is wonderful and beautiful. But I'm just going to get to the evidences here of validity. So one of the first analyses we did was sensitivity and specificity. And sensitivity, I'm sure you all know, is all about how well the test accurately identifies the children with the disorder, and specificity is how well the test identifies children without the disorder. Those two sources of evidence are very, very important for a test that has the purpose of identifying disorder. And you can see the sensitivity and specificity here. This is for language, for the language learning index, and this is for the entire grades or ages just collapsed here, 5 years old to 14 and a half. And the sensitivity was 95% and specificity 91%. Now this is the optimized. So we have an optimized cut score here. So you can see that the cut scores are a little bit different based on the ages. Here's the ages going along the column here. And this is the sensitivity and specificity based on those optimized cut scores. And these are sums of scaled scores is what these are. If you just choose to use the generic cut score of 20, this is the sensitivity and specificity that you get as well. Okay, so we're in the mid 90s, low to mid 90s, sometimes 100% on the sensitivity and specificity for language. This is the sensitivity and specificity for the multilingual. So we disaggregated the multilingual data and looked at that specifically. This is 385 children with typical language and 75 children with language disorder. And the sensitivity and specificity, as you can see, doesn't meaningfully vary. It's not significantly different between the children who are monolingual English speakers compared to those who are multilingual. It's a very important piece of information, obviously, because one of the promises of dynamic assessment is that it mitigates the cultural and linguistic bias that you sometimes get from a static assessment. So sensitivity and specificity are still in the 90s for multilingual children. And then we did additional breakdowns. So we looked at the sensitivity and specificity, just at a comparison table here between the entire sample and the multilingual sample, which you can see it's still excellent sensitivity and specificity. And then we also did it by, you've got male, female, and we did sensitivity and specificity by race, ethnicity. And you can see that there's really no like clinically meaningful differences in sensitivity and specificity across different races and ethnicities. And that's also true across regions, across the United States, and socioeconomic status. So now this is considerable evidence for bias and or the lack thereof, right? So it's very important to understand that this test is designed and is appropriate for the diversity that is in this country. And this is for decoding. And we have essentially the same findings for decoding. You can see the sensitivity and the specificity here across ages for identifying children with dyslexia. And these are the specific cut scores. This is the generic cut score. Okay, hopefully that's all interesting. And then once again, we did the analyses for multilingual children and all the different demographic breakdowns that we did, and there was no significant difference across any of those variables either. Okay, so now I got a little spiel about base rate, and I'm just going to zoom right past it. I'm sorry about that. Some likelihood ratios. I think another interesting thing, it's just an additional source of evidence here, are the tables. So we show the tables. These are scaled scores. So scaled score means and standard deviations. And these are the scaled scores. This is for the dynamic assessment of narrative discourse, by the way, right here. This is the mean and the standard deviation for the children with typical language learning, and this is the mean and the standard deviation for children with language learning disorder. And you can see the subtests that are used to identify language learning disorder have very, very huge, significant differences in the performance between the children who are with typical language and those with language disorder. And we did that same analysis also with the dynamic assessment of decoding. So so all we're doing is just building a case. And that is really all of these technical manuals are all about, is just building the case that this test it really does what it's designed to do, and that the interpretations of the results can be valid. Okay, I know I'm talking fast, I'm talking a lot. Last thing I want to show you in the psychometric, that's not true. One of the last things I want to show you in this technical section are the box plots. And these box plots tell you two things, the ones that we've got here. The blue bars here are the children who do not have a language disorder, and the gray are the children who do have a language disorder. And what you can see is a developmental pattern for some of the subtests, for the subtests that we expect children to vary according to age, so perform higher or better. As age increases, we find that happening on those particular subtests. And here's one of the subtests that's used to identify language disorder. You can see very clear um, developmental growth, but you also can see a very clear difference in the performance between the children with language disorder and those without. So two sources of evidence here from from these graphs. And then also on the sections of the diamond where we don't expect variation according to age. For example, like a child's modifiability, their language learning potential, you can see that you don't see that growth or that change over time. And so this is just evidence of the construct that we're measuring, that we really are measuring this language learning potential with these particular subtests. Okay, so I don't know if that's interesting to you, but it's interesting to me. And I feel like it's really just an additional piece of evidence for this particular test. And then factor analysis, which I'll just skip over for now. Okay, one last thing I want to do. I just talked about bias already, essentially, by showing that the sensitivity and specificity don't vary. And also the mean scores in scaled scores for the typical children also don't vary meaningfully, according to monolingual, multilingual children, and so forth. So those are all very important takeaways. The only thing about reliability that I want to say is that reliability is just as important, potentially just as important as validity. And you could have a test that has great sensitivity and great specificity, but if the confidence intervals, which are based on the standard error of measurement, if those confidence intervals are way too wide, there's too large of a band, then the end result is an interpretation. It's impossible to interpret the results. So what we did with the diamond, we're following actually standard guidelines to use conditional standard error of measurement, because the standard error of measurement can vary according to student performance. So students who perform lower on the test or do worse on the test, they tend to have a smaller range of variance compared to children who are in the middle. And so we have conditional standard errors of measurement, and you may think, I don't know what that means, or do I care? You care a lot, because the standard error of measurement directly relates to the confidence interval, and it is the confidence interval that actually represents the student's very likely true performance in the real world. It is not that single standard score, that single percentile rank that you obtain from a test like this. It is the range. And that's because every test has imperfect reliability. So you'll find in the tables for standard error of measurement and for confidence intervals, you'll find a pretty narrow band for a lot of the children, especially those who have language learning or decoding learning disorder. What that means is it gives you much greater confidence that the performance on the test for that particular student really does truly reflect their true score in classical test theory language. So that's about all I want to say about test-retest reliability and inter-rater reliability. It's in the interclass correlations are, for the most part, excellent. And so you can look through the manual and see that as well. Okay, now I think that that's about all that I really wanted to say in this very, very broad overview here of the diamond. Now, there's a lot more that I can say, obviously, about it, but that's just kind of like my brief overview, and I'm really happy to take questions if there's any questions about it.
Yeah, we've got some questions queued up here. So in the Q&A section, our first question comes from Lynette. She says, I saw your presentation at ASHA last year with respect with your normative data on using MLL in your normative sample. What level of English acquisition would you say that your MLL were? Entering, emerging, transitioning, expanding, or proficient? My population in my district is over 60% MLL.
Right. Yeah. So those multilingual learners, those multilingual children, I can't tell you that there is that you cannot administer this test to a child that knows no English at all. I've tried that. Well, you can do it, but it's not great. It's because they still obviously have to understand the very basic instructions. Now they don't have to do a lot in this test. They just have to understand that you want them to tell this story. If you can get that across through gestures, that's wonderful too. And they also don't have to produce a lot of language because it is not about what they can do. It is about their learning. And so even if they're just giving you one or two word utterances, that's okay because then you will expand on that in the teaching phases. So oh my goodness, what were the options that you gave me? I'm going to choose the lowest um, level of English language proficiency that you gave me in your list. That would be appropriate and that would be acceptable for most children. Now, if their MLU is lower than 2 and they do not understand basic English language instructions, you might have to do something different. But for most children, I think there were 10 children out of the 1,500 or so children that we tested. I think there were 10 that we could not administer the test to.
Perfect. Thank you. That was great. Our next question, do students, particularly kinders, need to know their letter sounds before completing this test? I'm thinking about the decoding test. That's from Terry.
Right, not at all. No, there's a little pretest, and we'll have the students read these nonsense words. And if they don't know anything, you don't belabor that by any means. If they don't know anything, that's okay. And you tell them it's okay, and you move on to the teaching phase. And if they don't know any graphophonemic letter sound correspondences, that's okay. You'll teach them. And they're not going to learn. You're not teaching them, by the way, how to decode in these 5 minutes, right? That's not the point of this. They're not going to walk away a reader. But what you will see, if they have typical decoding learning ability, you will see growth. You will see that at the post test, they will actually begin to identify some letter sounds for you, and some of the children will start blending. Um, and so just know that the purpose of that, right, is to measure their learning potential. And that is what you absolutely can do. And again, I talked about this with language, about how one of these core, hallmark characteristics of developmental language disorder is a learning disability. Well, that's also true for dyslexia. It is a learning disability. And so that is really it makes a lot of sense to identify those disorders by measuring someone's ability to learn. And you don't have to walk through this process of RTI or MTSS for several months to measure their learning potential. You can do it in just a few minutes through dynamic assessment.
Great. We have another question from the chat. First of all, in all caps, this is awesome. But any feedback regarding how it is deployed in schools? Is it SLP driven, psychologists? They're looking to use this for screening, but they're curious about how it's rolled out in the real world and if it improved collaboration and evaluation.
Yeah, great question. So how is it deployed in schools? Well, you can see that this assessment will very clearly help you identify language disorder and or dyslexia or decoding learning disorder. And I feel like I've made that term up, by the way, decoding learning disorder, but I'm happy with it. I'm sticking with it. Um, and so I can't say, oh yeah, this test is exclusively designed for speech language pathologists, right? Some SLPs may not take on this process of identifying decoding learning disorder, and that's totally okay. We have other professionals in the schools who do that. And so how's it deployed in schools? Speech language pathologists, um, school psychologists, other educational professionals who are trained to engage in this type of assessment where diagnostic process is the key purpose. And so now, now that can be done obviously through referral and through then like very, specialized specific assessment. But also we have administered this test as a universal screener to hundreds of children as a universal screener. And we have some provisions in the manual about that, about if you're going to use it as a universal screener, then these are the particular subtests that we recommend that you administer and the interpretation of those. So it can be used as a screener. I wouldn't hesitate to do so. But I I guess I think when we started out, we envisioned this primarily being used a test, as part of a process of evaluating a child for the need for more specialized instruction.
Great. Now these next two questions kind of go into each other. So if you could just explain this. So the first question is, can you clarify when you would use the diamond versus the pearl? And then the next is asking about the cube. Is the cube the screener? Diamond is the diagnostic. So can you paint the picture of how all three of those work together, when to use them, so forth?
Absolutely. Yep.
Great.
Yeah. So the Pearl is preschool, kindergarten, universal screener, and its purpose is to be administered as a universal screener to those young children. The outcome of the Pearl is a raw score, and it is a criterion reference test. So it does not, you do not convert those raw scores to standard scores of percentile ranks. You don't compare that child score to a normative group. Instead, the scores from the Pearl are compared to the criterion. And that criterion, by the way, was based off of regression analyses that we've done with thousands of children. Um, so there's a key difference there. It's supposed to be very quick, very efficient as part of a quick screener to identify children very early on. The Diamond was designed to be more diagnostic in purpose, not a universal screener. It can be. Excuse me for making these little parenthetical statements, but I'm just saying that the primary purpose of the Diamond is diagnostic. Once you've identified children who need additional help, and you begin your intervention with these children, you need to monitor their progress. And that is the purpose of the cube. It is to monitor progress over time. So that's kind of how the three assessments and the family fit together.
Perfect. Well, that's all of the questions we have. Oh, wait. No, we just got another one. Never mind. So this question from Kate says, if I give the test as an SLP on a speech-only assessment and find decoding or dyslexia needs, how do I convince my MTSS team or school psych to use the data to qualify a student?
Oh, sure. Yeah, well, I mean, we went to great pains to outline in the technical section of the manual that how the interpretation of this test can be valid. And so that's the convincing evidence for your colleagues, right? So here is the sensitivity and specificity for identifying decoding learning disorder, e.g. dyslexia. Um, and here are the children in the sample. Here's how the reference standard was established. I mean, that's just simply the evidence that you present to them. Um, and so no single test, of course, is supposed to be a definitive diagnostic assessment, right? So it should be part of a suite of assessments and processes, observations and interviews and so forth. But yeah, let's see, I'm not quite sure how to say this. The evidence that we have that this test does what it says it does is very strong, and it's as strong as, if not stronger, than other assessments that measure word recognition or dyslexia, etc. And in fact, it is far superior if you're administering this test to a child who is culturally, linguistically diverse. Because if you administer a test like a test that's designed to identify dyslexia, a traditional static assessment that's designed to identify dyslexia, and you have a student who, for whatever reason, has had limited instruction or what have you, there could be some cultural, linguistic, historical factor that confounds the interpretation of those results. And we see that all the time. You see that with kindergarten children who are administered static assessments of decoding related assessments like phonemic awareness and letter naming. The floor effects are horrific. The floor effects make it so that it's really essentially uninterpretable. And so I guess really it wouldn't be, how can I convince someone that this test should be used? It would sort of be like it well, I don't want to I don't know what to say. It's going to be very likely it will be superior to what they are already using. Okay, was that too much? I'm sorry, Christy. I don't know what to say.
I wouldn't say that was too much. I think that was
Okay.
perfect.
Okay.
Okay, so we have a follow-up comment from one of the questions you had already answered. Lynette just wanted to follow up saying, I think this is great in general because 95% of my referrals come from RTI reading. So the possibility to differentiate decoding difficulties from a language disorder is a changer. And we should be moving away from assessing students with just static assessments as a profession. Thank you. Most bilingual therapists already perform dynamic assessments due to difficulty with static tests.
Yeah.
Awesome stuff.
I love it. Right. And I know dynamic assessment has been around a long time. And shout out to the most amazing pioneers in this field, like Liz Pena and Ron Gillum, Lisa Bador, Achilles Iglesias. We have so many amazing people who have established this amazing foundation. Um, and it has been around a long time. And the question always is, and by the way, all of the research, almost every study comes up with phenomenal sensitivity and specificity. And you have to ask yourself, why is this not being done? And we tried to answer that question, right? It's not being done because often it's not perceived as standardized, it's not efficient. Often it's a little bit, sometimes people feel like it's too based on clinical judgment. Well, we tried to address all of that. And also we recognize, right or wrong, which by the way is generally wrong, when states require you to use a norm referenced assessment for the eligibility of services. We tried to address that as well, though, by providing a norm reference interpretation of the data. So I'm very hopeful that this is going to be helpful to everyone out there actually who's engaged in trying to help our children be successful.
Agreed. That's great. So we have a question from a familiar name, Callie Knight. She's asking, hypothetically, could you usefully utilize the modifiability rating scales and potentially the instructional methodology in the teaching phases from this test in a general sense with other language tasks for younger children around 18 months to 4 years old to help objectify our subjective observations when completing an informal dynamic assessment. And she follows up with, obviously, you can't use the data from this test to interpret formally, but it seems the modifiability scales in a general sense could help objectify subjective feelings during an information dynamic assessment.
Yeah, we do have specific data on that actually because with the revisions of the Pearl that we're undertaking right now, we've administered this to several hundred children now. We use a very similar modifiability rating, the behavior scales and the learning scale for those children, and that's for 3-year-olds, 4-year-olds, and kindergartners. So absolutely, that's true. And I also know that, and I apologize. I know that Joseph Lamb was part of this group, and I think Liz Pena was, and same with Ron Gillum. And I'm probably missing some authors, and I'm so sorry about that. But they also just published behavior scales, or I shouldn't call them behavior scales, modifiability rating scales that can be also generically applied to different assessments. And so that also would be very important to look at. But I mean, I love that idea, Callie, and I think that there's nothing at all wrong with taking a static measure and converting that assessment to a dynamic assessment. You have to understand, of course, when you do that, that you're not going to be converting those scores to standard scores of percentile ranks anymore. It wouldn't be a valid interpretation, but that's okay. We can absolutely identify children with a language disorder or with decoding disorder without norm reference interpretation. So I love your thinking. I've always loved your thinking, of course. I'm so glad you're here with us.
Awesome. We've got one more question here from Basim. So, were the children in the studies from pre or post-pandemic times? The face of our classrooms has changed.
Yeah, what a great question. What a great question.
Mhm.
So we have children from 2018 to 2024 to 2024. So we really kind of captured the span of children before, during, and after COVID. And well, yeah, I guess that's the answer. I was going to say that, I feel like I have another lifetime of data analysis ahead of me, but I'm not going to do it right now. I'm going to take a little break. But yes, we do have children who are absolutely in that cohort that came through the COVID-19 situation. Now, one of the questions that or one part of the question that I think I forgot to mention or address was if this assessment improved collaboration in evaluation. And I think that's a really great question because people get very territorial and they can feel like this is not my job, this is your job, and that's fine if they feel that way. But um, this particular process, this dynamic assessment process, applies to multiple domains, language, decoding, and of course, many others that we haven't addressed yet. Um, and and so it does, however, facilitate this communication and interprofessional collaboration that we already really have in place in the schools. It just sort of brings it together even more, where we're all working on helping these children, and we can identify these children through this dynamic assessment process and support each other in doing so. And so it's okay if this resource comes from the speech language pathology world. That's okay. It doesn't really water it down to the school psychologists. They can still use it also, and vice versa, by the way.
Awesome. Thank you. Oh, we've got one more that just popped up. So one question says, I may have missed some of the pieces of this assessment in the overview. Does it look at grammar? I'm worried that non-SLP professionals may give this test. The language piece looks okay, and the language is ruled out as a challenge without some key pieces being looked at.
Yeah, it does. And I did gloss over that, and I'm glad you brought that up. So yes, actually, there are underneath the behavior scales, there's scales that we have called complexity scales. And the examiner takes into account morphosyntax, vocabulary, and sentence complexity. And then the last part of the protocol is a deeper dive into morphosyntax and vocabulary complexity. And um, and so the only caveat, of course, is that if a child is having difficulty with morphosyntax, for example, it is our responsibility to make sure that that difficulty is not due to a dialectal cultural difference, right? We have to make sure that that very likely is due to a language disorder, but that is something that you account for in this test. And in the learning scales tell you to take that into account. So there are some children, not a lot, but there are some who will do quite well in learning the story grammar, but they will have considerable difficulty with morphosyntax. And that difficulty with morphosyntax absolutely influences your rating of their overall ability to learn language. And the test is built to funnel you in that particular direction. So I'm glad you brought that up. That's a really great point.
Wonderful. Well, as of right now, we don't have any additional questions. We have a few more minutes, so if anyone wants to ask a last question, now is the time. But for the time being, I put a few links in the chat. So if you want to receive a certificate for attendance, please fill out the Google form that is linked there. I've also put in the link to pre-order the diamond. Be shipping the first week of January. So if you're interested in purchasing the diamond, go ahead and follow that link. You'll also be able to find additional information about the diamond on our website using that same link. So be sure to check that out if you haven't already. But as we wait for these last few minutes of our webinar, Dr. Petersen, is there anything else you would like to add or wrap up about the diamond now that you've introduced it officially to the world?
Yeah, well, I think just in closing, the only thing I'd like to say is that I am so excited to share this with everyone, and I'm so excited that it's finally actually available for people. Um, the the idea here, of course, is that it is a norm reference dynamic assessment of language and of reading. And I am so hopeful that the consequences that we've outlined in this manual and what we outlined and set out to accomplish, that these consequences will come true, which is that you are identifying children who are culturally and linguistically diverse, and you're identifying them those children who truly do have a language learning or decoding learning disorder, and that our resources are focused on those children who need the most intensive instruction. Um, and we're so hopeful that that leads to improved outcomes for our students who need the most help. Also, we're hopeful that if it's applied as a universal screener, that it can help identify those children who likely will need more intensive instruction. And you can identify those children early on and immediately instead of belaboring the process and then providing the intensity of instruction that they need to help them to succeed. That's the big picture and that's the vision. So I hope the diamond is a tool that helps you accomplish that along with other goals that you have. So I think that's all I've got.
Awesome. Thank you so much, Dr. Peterson, for your time, for delivering this to the world. It has been a long time coming, and it's a pleasure to see it. We had one comment in our Q&A that says, "Thanks so much, Doug." This is from Christiane. I'm going to butcher her last name. Dechert,
Oh,
Dechert.
that's my friend Christiana Deschert. And thank you, Christiana.
Wonderful.
You know we love you. Amazing.
Yeah, she says it was great to see your new work. Greetings from Western Washington.
Love it.
Awesome. Lots of thank yous in the chat. But yes, thank you so much for your time and for providing this. This is seriously wonderful to see be presented to the world. So excited to see where it goes. But everyone, thank you for attending. I will be sending out a link to the recording of this webinar tomorrow. If you registered, that means you're here, meaning I've got your email. So you will be getting that tomorrow, as well as a link to the form to make sure you get that certificate of attendance if you don't have the time to do that now. So keep an eye out for that. Again, the link for pre-orders are in the chat, so make sure you capture that. But until next time, thanks everyone.